I went to the doctor and he told me that I had multiple myeloma leukemia and that I had a lesion on my sternum. I had one on my spine and one on my skull, and that the cancer was through my blood. And I asked him in his office, could people die from this type of leukemia? And he just said, I'm going to be frank with you, people die all the time. I started thinking immediately who would take care of my kids, and I just started going down this road of kind of like a contingency plan for my life and what I was going to do. The first thought was about my daughters. I had just had a baby. She was 6 months at the time. And I just began to think about her and my husband and what my mother would think and how could this be cancer. I was so young. I had went to the doctor. The doctor said, we need to give you this type of medicine to get you ready for the bone marrow transplants. And I remember I went home and I'm praying and asking God and seeking him, how can I get through this? How can I live through this cancer? And one day I would always get in the shower and I would lay hands on myself and I would pray and just ask God to remove this cancer, that nothing was too big for him. And one day, after about 2 weeks of doing that, I got in the shower and I was actually laying hands on my sternum. It feels like it feels now. It was flat like this. And I remember could it be, it's different. And I remember I jumped out of the shower just like I was. I ran down the steps to my husband and I was like, Major, feel this. Does this feel flatter to you? And he's like, what are you doing? And he touches the space and he's like, it does feel flatter. And I said, okay, I'm going to get dressed, call the doctor. Jesus healed me. I knew it. I knew that he had healed me. And we went to the doctor and that's what it was. It was healing. He felt the sternum and he was examining me and he said, well, it appears that it's just bone there and scar tissue. And I kept saying, I told you Jesus healed me. I told you, he was real. And he kept saying, wait a minute, we need to go through the test and the MRI, the protein test. And I went through all the tests and the way he described it was that the tumor on my skull and the places that they were on my spine, that it was healed over like you would have a scab, like if you had a cut, it was healed over. And he also said that they couldn't find any in my blood. And so he said, but you still need to go through the treatment because it probably will come back. I can't believe that it's just gone like that. It doesn't happen like this. I went home and I prayed about it and I left the hospital saying, I'm not going through. Why would I suffer and go through this treatment? But I didn't have any peace about it. And I kept praying and my husband said, I can't get peace with this decision not to go through this. And so I went back in and I said, I'm going to go through this. I feel like God is telling me that I need to go through this for some reason. I don't know why. And when I made the decision, I actually had a peace. I had this peace that came over me. During the treatment process, I learned that God never leaves you or forsakes you. When I went through this treatment, it was the most horrible thing that you could go through, but I was known as the happy patient, the patient that was always joking and, having a good time. And it was that God sat with me during the treatment. It was like he was sitting holding my hand and he was with me. And I learned that he's always with you and he will do what he says he will do for you. I realized that all these things that I needed, these type of services I needed when I was going through cancer, that other people probably needed these type of services. So I needed to go through what I went through to know what cancer patients have to deal with firsthand. Based on what I learned going through chemo, I started the Rock Cancer Care Ministry at the Rock, and we provide services such as transportation to chemo appointments, grocery shopping, prepare meals and deliver them to chemo patients. We also sit with them at the hospital. We pray with them. We fast. We do whatever we can do to fill in the gaps of their care.